Hi, everyone. Thanks so much for joining our webinar. I've got the MIMS team here with us, and we will be going through some tips to navigating your first year of residency and beyond. So one of the questions we have is, as a fourth year student, we followed 4 patients in about 2 to 3 weeks. As interns, we will follow up to 8 patients or more. What would be the fastest and most effective way to chart, check, and prep and pre-round on many patients and still finish our notes and be ready for rounds on time?
That's like your question, Andres.
Yeah, I'm like looking in this little room here. So, good question. I know it could be overwhelming, and I'm sure that's probably coming from a sub-I or your experience in your core rotation in internal medicine. I do applaud you for that question in the sense that you do want to be efficient. I think to survive residency and intern specifically, you need to be efficient. But there's certain things that are expected of you. Number one, I think first and foremost, your resident and your intern or co-intern all expect you to just be coachable and someone who's willing to take, responsibility for your patients and be a team player. I think that'll go above anything I can tell you as a recommendation. I think getting to work on time and knowing how long it takes you to pre-round, I think during your 3rd and 4th year, you could find out how long it takes you to really know a patient well. You see them, examine them, be ready to present their labs in the morning. The role of the resident is supposed to supervise and make sure that they know exactly, what's going on. So if you don't know, you have that support from your upper level. So that should not freak you out. And lastly, I'll say, you don't have to have your notes ready before rounds. I've never, and I'm going to be chief at UM, I've never once had my note done before rounds. I've had it almost done, or I've had it semi done, but never complete before rounds. So that's a misconception, and I don't think that's an indicator of success by any means. So just, be coachable, be a team player, be prompt, never be late, and just, try to know your patients as best you can, because really, as an intern, as a 4th year med student, that's the role that you're going to have. When you're a senior resident, you're looking more from the periphery. So we miss the fine-tuned details that you guys pick up on.
Awesome. If there's nothing else to add, let's jump into the next question. So how do you balance USMLE Step 3 preparation with first-year rotations?
AJ, you're muted.
AJ, you're mute.
You're muted again.
Can you hear me now?
Yeah.
For me, so it'll really depend on your program. Some programs, they set up kind of like a dedicated time where it's a lighter rotation for you to study. But really what it comes down to is you need to decide when you're going to take it and talk to some of the upperclassmen that are in residency with you about which of those rotations are best for you to, go to work and still study a little bit. And then, you're just going to have to take it at that allotted time that you have. I wouldn't recommend necessarily starting now going into it. I would just kind of wait until you kind of see what's going on with your schedule and then talking to your upperclassmen and seeing what times they usually take it, because I think each program kind of does a good job of kind of setting up a schedule so then everyone has an opportunity to take it and has a reasonable amount of time to study.
Awesome. Let's go to the next question. So what advice or strategies helped you become more efficient in your day-to-day?
So I would chime in on this. I think time management is a big thing. Understanding that you have to make small, realistic goals and make some sort of routine. So what I mean by that is throughout the day, you're going to have so many tasks, so many patients. And like someone else mentioned, you may have up to 8 patients in a day if you're in internal medicine. So how can you possibly manage all of that? You got to prioritize and see what's your priority, and you'll have your senior level resident to kind of help you guide you through that. But I think that to be more efficient, it takes attitude, it takes grit, it takes someone who's willing to understand, like, I'm here to serve my patients, I'm here to take care of my patients. It's a little bit different than medical school. So you guys have to kind of take on this new role. But being efficient is really just commitment, and get some tips from people who've done it before you. By no means would I be, and I can speak for pretty much everyone in this room, there is no way we would be where we're at if it wasn't for the people above us giving us tips. AJ and I have a very long friendship, and one that's like a brotherly role where I learn from him, he learns from me. And really, that's what you got to develop from not only your friends who are in other programs, but from your senior level residents who can kind of walk you through their day-to-day, what they did in their intern year. And, that's what's helped me get through my clinic days. That's 100% true. So.
Yeah, that's really true, and especially with like managing the EMR and navigating to the different EMRs and whatnot. I mean, your upper levels are going to be huge, or even other fellow residents in different programs and stuff like that. Everybody knows the tips and tricks that they kind of share with each other. Same thing with like dot phrases or auto-populating. I mean, it's all stuff you get from your co-residents in upper levels.
Awesome. So what do you guys think is a cheat sheet or algorithm memory aids that you would recommend to carry with us at all times as new interns at the hospital?
I think that depends by field. So why don't we go one by one based on what we would do in each of our fields? What do you guys think?
Yeah, let's do that. Lucia, if you want to go first.
At least for general surgery, the one thing I always carried around was my Pfizer book, which is the book kind of cheat sheet for the in-training exam. Pretty much all the high yield stuff that you're gonna or need to know for any rotation, any surgical specialty is gonna be in that book. So whether it's for a certain case that I need to look up quick facts, or I have 30 minutes downtime, I can just study real quick for the in-training exam. So at least that was the experience for me and what I carried around.
For me, the one that was most helpful was online MedEd had like a PDF with just like how to like write notes and like be organized, and so I use that. But it also really depends on your program. Usually, your upperclassmen, they'll give you like a training, like a training handbook for each rotation, and they'll put in the most common diagnoses and the most common workup. So I think kind of really leaning on your upperclassmen, the other people in your program, they'll provide you with that, at least here.
For internal medicine, pocket medicine, it depends. For me personally, up to date is my main thing. I have up to date, and most programs will give you a license to use it. At University of Miami, they give us access to the library. So maybe some of the libraries with your affiliated programs will give you access for free. I have that. I'm on it, I think 5, 6, 7 times a day. Some people like pocket medicine, and I think they came out with a new edition, but mine is an orange book. It fits in your white coat. I'll be honest, I haven't worn my white coat since the pandemic started, so I really find it annoying to carry it around. But I think that's one thing that people have referenced. There's people in my class who have referenced that. So between those two things for cheat sheet purposes, I think that's all you need.
And then anesthesia, there's a UCSF came out with a pocket anesthesia reference guide that's pretty good. A lot of people have it laminated in other programs. I just keep it on my phone, and it has drug dosing, important contraindications for drugs, and just kind of pharmacology like tips. It'll also have like case management, infusion dosing, a bunch of things like that. So that's pretty helpful.
Can you hear me?
Yeah, we can hear you now, Chuchi. Yeah.
Okay. Yeah. I think for EM, I would say like in the beginning, I used a lot of like EMRA, so like the emergency medicine like resident association. They give you like a book when you first sign up. I also use a lot of like Wiki EM, because I feel like EM, you're seeing a bunch of patients all the time, so like it has to be something quick. It's not, you can't just like read on shift because you're always seeing patients. And I think also with EM, you're working alongside like other attendings and other residents, so you bounce off ideas with each other. If you're having trouble, there's always someone there you could ask. But also just after your shift, if you have a patient or you get a diagnosis you've never seen before, I think it's important just to like go back and just like read up on it. So I always found that helpful.
Awesome. If we want to go through or invite our other two residents up. You know, if not, we can move on to, should we review anything before starting intern year?
You want to go first, or I'll go?
You can go first. You go first.
So I feel like, I'm a second year, and I feel like, I guess my med school like fourth year was like cut short because of COVID. So I kind of like had, I guess you could say, like 3 months off prior to like starting residency. And I kind of just like used it just to like relax and just like, because you're never going to have that time off ever again. So I think as like a med student, I wouldn't go ahead and like, you know, boggle down on like studying and trying to go ahead and learn everything, because you know you're gonna be busy during residency. You know, residency is hard. You know, you're always gonna be working, and I think you should enjoy this time now, because you're gonna wish you had that time off. So I would just do what you're doing now, and then prior to starting residency, just take a break. I don't think you need to go ahead and go into residency at like full force, because you know, I think you're gonna burn yourself out if you do.
I agree. I
Completely agree. Study.
Yeah, just enjoy
ahead,
your
sorry.
time off, because you'll never have that amount of time off until you're attending. And I think once you start intern year and residency going forward, it's lifelong learning, and you'll have time. You know, as long as you're coachable and you are taking the initiative to like learn your patients and learn the things you don't know, I think you know you can approach it in that manner.
Fantastic. It looks like we do have Annabeth and Melissa on here, so I'm going to cut 2 people back just so they can weigh in on their advice. So give me 1 second here, and we'll bring 2 people back in. Okay, and while I'm pulling them up, just to get your insights here, what makes residents stand out in your opinion?
I think that's very field dependent, but from an anesthesia perspective, I think it's pretty easy. All you have to do is just have a good attitude, be easy to talk to, you know, kind of know when to stay out of the way and when to help. That's more like intuitive once you get in there. But from anesthesia, it's pretty straightforward. I think tougher is EM and IM. So one of you guys want to take that?
I mean, it depends like how you want to go ahead and like stand out. Like if you want to like stand out in a bad way, I would kind of say, like, you know, just there's a lot of different ways you could stand out. But I think if you want to stand out in a good way, just, you know, take it for what it is, you know, be there, always want to go ahead and like learn, and, you know, be coachable, like kind of like what Andres was saying before. I think that's the most important thing is, you know, you don't know everything. I think that, you know, as long as you take that into account, I think, you know, you'll stand out for what it is. You'll stand out without even, you don't have to try to stand out.
Yeah. For IM, I feel like, you know, our rounds typically are longer. And I think the qualities that I look for in an intern that are strongest are ones that, like I said, you know, being coachable, someone who's willing to be on time, knows their patients well, you know, doesn't lie, doesn't say, oh, I listened to lung exam and this morning, you know, there's crackles at the bases, and then you go over there and they're clean like a whistle. You know, always be very direct, very straightforward. If you didn't do something or you don't know something, you say, I didn't do it, or I didn't know it. I don't know. I think the other thing is, I think what really sticks out as a medical student and even as an intern is bringing teaching points on rounds. You know, a lot of us here in the South Florida area, we see a lot of very interesting things, but this is any program really. I'm sure Melissa and Annabeth have seen a lot of stuff in their programs and they're not down here, but really, like, if you bring in something that we haven't heard in a long time. I saw Wilson's disease patient last week. Our med student brought up a great teaching point on how to look out for it. How do you screen for it? How do you test for it? So I think that bringing something to the team, even though you're doing a little bit more than what's expected of you, will always make you stick out. If that's really the question, I think the biggest thing is to do something a little bit extra, and bringing in a teaching point is a big part.
Yeah, I'll definitely second that. I think another thing that can be very helpful is to be very teachable, like know your limitations and like know when to acknowledge that you don't know something, because they're going to see right through the facade of, any BS you had as a medical student that could make you fly under the radar. And like the fact that you want to learn, or like you say, oh, okay, I'm going to go home and like look that up. And then the next day you see them, like, you know, you talk about something that you learned, that shows that you're actually interested and engaged. And that's 1,000 times better than being the smartest person on rounds, or like, you know, it's the team player, and people are going to like you. And if you are the person that's the know-it-all, you're not going to be liked, and it's going to make residency really hard.
I
I'm going to toss it
agree.
over
And
to
just like,
Melissa too, if you want to chime in. I know you didn't get to intro yet, so if you guys wanted to do a brief intro as well, I think that would be great.
Sure. I'm Melissa. I'm a second year OB resident. I'm in South Jersey, Philly area. I would say the biggest thing is you don't need to be the smartest person in the room. You don't need to be like the best resident ever. Just as long as you're interested, hardworking, and teachable, those are like the three biggest things. Nobody's going to fault you for not knowing the answer, as long as you don't make things up.
Awesome. If there's nothing else to add, I think, Annabeth, if you wanted to go ahead and intro before we moved on to the next question.
Sure. I'm Annabeth Johnson. I'm a second year ED resident at Morristown up in New Jersey, but I went to Nova with AJ and made the transition, moving somewhere completely different, which I don't know how many out there are like making a big move to start residency. So if you have any questions specifically about like how to, you know, set up shop in a whole new city, definitely reach out to me, and I'll put my contact info in the side, and feel free to email me or text me, whatever.
Awesome. Thanks so much. Let's go on to our next question. What are qualities in interns that you appreciate as senior residents? What characteristics does the ideal intern working under you have?
I guess I could start, or if you want, Annabeth. Again, from like an anesthesia perspective, I think everything that Andres, that everyone was talking about as far as being coachable, understanding your limitations, and being comfortable with, you know, not knowing things. If you don't know something, just let me know. I can teach you. I have no problem teaching. I enjoy that. It's like one of my favorite parts of my day, to be honest. And if you tell me you know something and you don't need me to teach, and I expect you to, you know, be able to do what you're telling me to. And that can kind of sometimes make it a little tricky for things, and slows the day down, really. So just having a good attitude, being teachable, and like Andres says, bringing something to the table as far as, you know, teaching maybe an interesting point or something like that. I always appreciate that, but that's not necessary.
I think something having gone from my intern to a second year, something I really appreciate out of the interns is when they, are interested in, you don't have to stay late. I don't expect people to like stay beyond their work hours and, totally grind every time. But if there's an interesting patient that's coming in that's sick that, is going to need a lot of work, or is like going to be a really good teaching point, just like kind of going the extra mile and showing your interest, even if it's just like coming in the room for the first 15 minutes and helping with, like, for example, in the ER, the resuscitation. And I'm much more inclined to like give an intubation to an intern, or, help with the procedure. I think just going that little bit of an extra mile and showing that you're like really there to learn is big, and people will really appreciate you for that and want to teach you, and they'll give up their procedures to to teach you to do them. So it's a good way to, snag some cool procedures and learn and make the most of residency, because that's what you're really there for, right? You don't want to get all the sick patients and the stuff there when you're supervised and you're not like on your own.
I think now we're coming up with nominating people for chief for the following year. We nominate our chiefs a year and a half in advance. And, one of the things that I came across were people that what did I remember from their intern year when I was with them as a senior resident, when I was voting for them. And I thought the biggest thing was you're going to rely so much in your intern year on your co-intern or on your med students or on your senior, and being codependent, but also being someone who's independent, having qualities on both sides where you can, run your ship, but also be able to be there for your partner. Things happen, residency is stressful, a pandemic put a ton of stress on all of us. Some people take it well, some people don't take it well, but being able to be comforting, someone that's willing to be an ally, a colleague, in situations that may happen. I mean, that sticks out in my head a lot, especially when it's your co-intern that's struggling, or, maybe not as fast as you are. You're taking the time to help them catch up to speed, things like that. It's the intangibles that sometimes translate more than just being a good resident and knowing your patients well. So try to make yourself distinguishable. And again, the whole theme of being coachable, and like Franco and Annabeth and everyone's saying, like, just be someone that's willing to learn, but also teach those who don't know. It could be your co-intern, it could be your med students. You'll be surprised. You expect someone from internal medicine as an intern to run a diabetes sliding scale and know how to adjust insulin requirements. Your co-intern may not. And being able to not ridicule them and actually sit them down and just be like, hey, let me show you my trick really quick. And it's pretty simple. And that speaks volumes.
Okay. Go right ahead.
No, I mean, I agree with what everyone's saying, being coachable. But I think the most important thing is just don't be lazy. I think that's the most noticeable thing. If you're lazy, that's people are going to notice that. But I think if you're hardworking, it's gonna show, and in the long run, that's what people like, as long as you're a hard worker.
Thank you guys so much. Moving on to the next one, just in your opinion, how do you think you should go about effectively managing, say, patient load and lists, just to make sure that all of the tasks are done in a timely manner, but without doing it where you're stressing yourself out? How do you find that balance?
So from an internal medicine side, I would say it depends on your senior resident, right? Your senior resident should be able to do a few things. One, I'll give you my example in Miami. A lot of people down here speak Spanish, so a lot of people in our residency program don't. So my first job would be to assign, like, who can you speak Spanish, can you not, and I'll split based on that. Secondly, I think obviously we have a wide spectrum of people who are coming in for osteomyelitis that really we're just dependent on the podiatrist and we're just giving IV antibiotics. And then there's some that are like requiring, they're this close to being transferred to the ICU. So being able to understand and know the breakdown as a senior resident, that's important to know. From an intern perspective, if you ever feel, and I think that most programs, unless you're at a program that's very malignant, which I doubt you guys will be going to, because there's guidelines for this, there's rules against this, but you should feel comfortable and open to talk to your senior resident. If you feel overwhelmed, if you feel like your co-resident or your co-intern has a lot more patients that are either easy, or you have 8 patients, your co-resident has 3, you should be able to feel comfortable in reaching out to your senior resident to like kind of split that up. And if that doesn't work out, another thing you could do is go to your program, go talk to your program director, talk to your associate program directors. That's their job. Their job is to basically monitor you, make sure that you're good, that you could do your job. And, if you're feeling overwhelmed, I mean, like I was mentioning earlier, the pandemic has put everyone on edge. And, if you're having coping problems, these are things that you need to speak up with and talk about. So my advice would be to speak up and don't stay quiet.
All right, we'll go ahead and move on to the next one. What makes residents stands out. Let's move to, did you feel like it was a bad look to ask questions frequently?
I guess I'll start. Definitely not. I think, I mean, the more you ask and you kind of figure out in the beginning, and you will learn quickly. But if you have questions that you're sitting on and you're just kind of hoping, like you can avoid it and it won't come up again, it will. So it's better just to confront it. And if you're not uncomfortable, or if you're uncomfortable asking in a group setting, just like ask one of your seniors. Like, I don't know how many times I've asked an attending on the side, or like asked a co-resident on the side, like, hey, I don't remember this, or I've just looked it up when I got home. But I don't think ever that asking questions is a bad thing, unless you're choosing to ask the questions and not do any studying yourself. There's a certain amount, you should have a base knowledge. And so it's your job at the end of the day. For me, I have an hour commute to work, so I will listen to a lot of ER podcasts and cover topics. So I try to get, some information, and then from there I'll ask questions. And so I think it's a balance. You don't want to be offloading all your learning to the senior sitting next to you who's seeing a bunch of patients, but definitely don't be afraid or intimidated, and find a way that works for you to learn, because a lot of medicine is learning on the job. And sometimes in that moment, that's your chance to get that piece of knowledge and grow as a resident.
And to kind of like jump off that, you're going to have a lot of questions when you start, like from super simple, like how do I put in a Tylenol order, to like really intense, like this patient seems like they're dying, what do I do? Like you're going to have so many questions, and you need to feel comfortable asking them. I don't think that you should worry about asking too many questions. And if you get to a point where you're asking like questions that you could look up on your own, someone will be like, here's a great resource for you to use to look that up at home. Like nobody's going to be like, stop asking me questions and leave me alone. All of us as seniors will we expect interns to have a million questions.
Awesome. I think if we're good there, I'm going to shift into another question. I'm going to remove a few people off the screen so that we can pull a couple people up. So there, moving in when I get started, let's go to what resources did you find most helpful for studying for step 3?
Well, so I guess I could start as a DO. Obviously TrueLearn. They have a great bank. I've used it for everything. I use that for anesthesia as well. They do a basic and ITE for us as well. So that I think is pretty much gold, because all the knowledge is there. You've taken step 1, step 2. Step 3 is a little less intense study wise, I think. So you can get away with just ensuring you practice questions, practice your wrongs, and reviewing any weak topics.
I think for visual learners out there, I think Sketchy Micro, Sketchy Pharmacy, I think a lot of us use that in medical school. I did. And to this day, I still haven't seen that material in 4 years. And for some reason, it's still in my head. So that worked for me. Some people, it doesn't work for them. But I think they also came out with Sketchy Pathology. I mean, these are, if you're truly a visual learner, that will really help you out a lot with covering antibiotics and bugs in your intern year. If you indeed go into specialties like internal medicine or anything where you require an emergency medicine, it'll be useful. So I think I also agree with Franco. I use TrueLearn. I use that plus first aid. I think I use for a little bit for specific things for step 1, not so much for step 2. Those are all the resources I used.
Okay, let's go on to what tips do you have in quickly reviewing the patient charts so you have relevant notes and time to see all the patients? What is it like the first week of intern year? And I know we have Dr. Tucker connecting with us now. He had a couple things that he mentioned in the chat, but if we want to go ahead, if anyone else has anything to add.
I think it has to, I think also this probably goes by specialty. So I'll talk about IM really quick. I think big things are 24 hours, going through a SOAP, really looking at what happened over the last 24 hours, looking at your vitals, looking at the exam, any changes in the exam in the last 24 hours. Labs, learn how to do the fishtail. How to report the labs, the fishtail, and also your white blood cell count, hemoglobin, platelet count on the cross that looks like this. If you have issues, just look pictogram, internal medicine. It's also on the back sheet of your pocket medicine. You can see that there. But these are simple ways that you can learn how to report common lab values. That'll be helpful. But just stick to that thing that we all learned in medical school. I think in internal medicine, it still translate. Even as a third-year resident, I'm still reporting it that way. So 24-hour events, vitals, exam, labs, or diagnostic studies, and then your assessment and plan. Keeping that consistent every time and being systematic about it will help you not only miss things, but also stay on top of everything.
So coming from like an emergency medicine resident who doesn't spend a lot of time, necessarily on the floors, but has done like off service, ICU rotations, and you kind of got to get a plan together. I very much second do the same thing every single time, and then you won't forget stuff. And then, you're not gonna be able to write everything down, but it's like kind of the same way in the ER when you're presenting a new patient, you want to start with, kind of like the basics of what the patient's there for, and then vital signs, the pertinent things to go through. But as long as you have a system, and like, even if you get there on day one, no one's going to expect you to know how to present patients perfectly. They know you're a brand new intern. So everything, you're going to have a lot of hand holding, but just make sure you lay out a way to organize yourself. That's the same steps every time. And that's going to be your recipe for success. And then you can tailor it as you get better at it to making it more efficient. But it's really just about doing the same thing every time. And not trying to change it every time. Otherwise, you're going to forget stuff and you're going to get flustered and your face is going to turn bright red on rounds. It's happened to everyone. That's the best way to do it, in my personal opinion. So definitely agree.
Okay, I'm going to move forward if no one has anything else to add. What is the most important thing to prepare for prior to the first day of medical knowledge EMR efficiency?
No, you're just, it is what it is. Like, you're going to go there first day. Like we were saying, like, you're not going to be able to put in a Tylenol order. Like, it's just, it is what it is. Nurses are going to get mad at you and whatnot. But like, honestly, I think the hardest part, probably like the first month, is not even the medicine part. It's just learning the EMR, and it's going to take some time, but it gets easier, after doing it so many times. But yeah, there's nowhere to prepare for that.
Yeah, I agree. I think you just got to be a team player, be coachable. I think pretty much the things we said earlier, be coachable and just be ready, to learn and just contribute in any way you can. I think that's the biggest thing. Have a good and figure out a way to keep like a balance, whether that's going to the gym and like doing some things that you like to do. I think that's also a big thing that you have to do, especially going through residency, because it's going to be like one of the most demanding things you've done your whole life.
I think one just thing to make your life easier that I'm thinking about it, the EMR, yeah, it's going to come later. Who cares? Don't spend any of your time stressing about it. It's not even a problem. The important things when you like on your first day, like figure out the first names of your nurses, because they're going to love you if you come up here like, hey, Rachel, like I need help with this, but like you should make it very personal. And whatever you do, don't introduce yourself as doctor, because that's the best way to get on anyone's shit list. Like no one's going to respect you for that. So I mean, everyone knows you're the doctor, and at the end of the day, they're going to listen to you, but they want to feel like you're talking to them as their equal. And the best way to do that is to feel like you've learned their name and you know them as a human and not just as the nurse that's taking care of patient in bed too.
Just to like hop off that too. I know for OB, at least, like the nurses, when I was an intern, were my biggest resource because they've been doing this like so much longer than I have. So I would like, there would be a patient, there'd be a decel, and I'd be like, what do I do? And they're like, let's start a fluid bolus or let's move the patient. And I'm sure it's like the same for other specialties too. Like in an emergent situation, they've seen it a million times and you've seen it like once so far. So huge resource, it's the nurses.
So moving on, how about handling evaluation reviews?
How do you handle evaluation reviews? So I'm guessing this is at the end of your rotation, you're getting some feedback and you're not sure how, or maybe you got a bad evaluation and you want to address it. So I'll try to answer both of those. The biggest part about learning is understanding that you're there to learn and you're being coachable. And we've made that the theme of this talk already at this point. So you're not expected to know everything off the bat. You're not expected to be great at everything off the bat. And I think a lot of us as medical students, we have this perfectionism problem where if we don't succeed on the first try, we are a failure. And I struggled with that a lot. And I realized once I started realizing that I'm not like that is when I started expanding my growth. Understanding that feedback should be given to you in a proper way is one thing. So asking for frequently, asking for constructive feedback. If you're getting feedback and someone's telling you you're terrible and you're doing a terrible job, you're a terrible person, that's not feedback. That's just wrong. I think getting feedback of, hey, how was my presentation? Is there anything I could have done to make my presentation better? Do you think I need to read on anything when I get home? How do you read when you get home? These are things that as you go along, you can edit little things here and there. And over the course of the year and your intern year, you're just going to perfect it. Now, if you got bad feedback from someone and someone says, listen, AJ, this is a rough month, not great. The biggest thing you have to do is reflect. What was it that I did wrong? What was it that I can be better at? If you got a bad evaluation, it's never going to be the end of the world. You have a full long 3 years ahead, 4 years ahead, 5 years ahead, depending on your specialty. And I think what you got to take out of it is what can I do better the next time? How can I improve? Because I started ICU my first month of residency and I never rotated in an ICU. And my attending left me a bad evaluation saying that I was a liability to the team, quote unquote. And, the funny thing is that a different attending came on and just walked me through how to present an ICU level patient. And from there on out, I was more than fine and capable. So you really need to get coaching from people who can walk you through and explain, diagnose your problems, but also be able to help walk you through and see what is needed to kind of get you to where you need to be.
Yeah, I agree on that too. I think you have to, when you get the feedback, just reflect on it and think about things you can do better. Like Andre says, I think we all are a little bit of a perfectionist, and you just have to take what you get and then figure out little things you can do each time. And as long as you're slowly improving and making those steps, I think those are the most important things. Because for us, we have co-resident evals and attending evals, and so obviously, you co-residents are more of like, are they a team player? And so you obviously want to help. If there's an extra patient and you have a lighter list, like you should take the next patient. So you want to do those things. But also, from your attending, you obviously want to have that knowledge base. So if it's you get several things where you don't know, and you're not taking that effort to go learn those things, those are going to be things that are going to be reflected in your evaluation. And so you just got to really carry yourself well and just make an effort, I think.
If you feel that, you'll get feedback at the end of a rotation, but you can also seek out feedback, in a private setting. You can talk to someone on the side, be like, hey, I've been here a week. What can I do to improve? And that's one way to kind of say last month you had a not so good month and that you're kind of feeling a little down about it, rather than wait to see, how does the next month go at the very end. You could proactively each time kind of be seeking things out, and then, you correct issues as they arise. Because sometimes people just wait to tell you things at the end of the rotation. Really, they should be like guiding you and helping you. And that would be the ideal world. So seeking things out and asking and seeking the feedback not only helps you, but it makes you look like you really want to grow, and people admire that, even if, you're not at the place they want you to be yet. So there's respect to it.
All right, we're ready to move on to the next question. Let's talk about mistakes. What have you guys learned that stuck with you? What are some things that you want to share from what you've learned off of these mistakes?
Too many to count. I will say the one that sticks with me the most is I was on a hematology oncology rotation early on intern year, and I delivered bad news in the worst way possible. So that is definitely a skill that you develop with time. It is not something that's inherent. There's no one in the world that I think is capable off the first try of giving bad news in a smooth way. I think it's a skill, it's an art that you have to develop over time. And thankfully I could say now that I've gotten there, but the first one was a terrible, terrible mistake. So whenever giving bad news, I would recommend having someone who's experienced and skilled in that regard. Try it first and learn from them. Sit there, watch them, observe them, see what they're doing. They're sitting eye to eye next to the patient. They're, walking through what we know. What is it that the family knows? And then getting to the point of what's going on and what's expected. Definitely, one of the things Annabeth said that's so true, know what you don't know and make sure that you delegate tasks. That if you're told, hey, go tell this family what's going on, if you don't feel comfortable and you're not there yet, ask your resident, hey, can I just watch you do it the first time? I want to see exactly how I should go about this.
Yeah, I mean, mistake-wise, oh, sorry, Annabeth, if you want to go.
There you go. You're good.
I mean, the ones that stick out most for me are anesthesia related, so that's not going to be helpful for everybody. And that, those types of mistakes will be like, maybe giving too much of a drug or not really going slow with medications and stuff like that, and having to fight that. But that'll affect kind of how you practice. As far as like intern year mistakes, I think the biggest one that sticks out for me would be my first month of ICU. We had just had COVID kind of take away our fourth year of med school. So it's been a while. I was a little rusty off there. And I remember I was told by my senior, don't worry, this is the last patient of the day. We just got a consult. After this, you can go. Just help me write the note. So when I went down to the ED with them, in my mind, I was like, I'm just going to write the note. I'm not going to have to present. They said they'd present it for me. So, I just wrote down kind of the basics for the note, but I wasn't following, as closely as I would have if I'd known I had to present that patient. So long story short, when we go upstairs, I quickly write a note. They were going to put the assessment plan, and then the attending asked them to present. And then the attending figured out that there was an intern, which was me at the time, and said, you know what, let the intern present. So when that happened, it was a complete disaster. I definitely got kind of chewed out for not knowing, basically what was really going on. And that's on me, because in my mind, I was like, well, you know what? I don't really have to pay attention. So after that, anytime I went to see a patient, it was game time. You have to know them well. You got to know what you're going to do and really be engaged and focused in your work. And that was a good lesson to have happen to me early, I think.
Sorry.
I think we'll give her a second to reconnect. But while we're waiting, Dr. Tucker, someone came in and wanted you to go into more depth about the Checkbox system.
So for me, Checkbox system. So I have a piece of paper, and I'll fold it in half, and I'll make basically a section for each patient, and then on for me specifically, the right corner, if there are orders that after I present or after I talk to my senior resident and they say, okay, we need to put in amlodipine, or we need to do 24-hour vitals checks, I'll just put a checkbox and put amlodipine, and then when I go to the computer and I put the order in, I'll put a check in the box. So just kind of like a checks and balance, just to remind myself, okay, I have to do this for this patient. Because I think for me, and this kind of piggybacks off the other question, one mistake I did at the beginning was I thought I was going to remember everything. And you'll quickly realize there's so much going on that you will not remember everything. And you have to have a system to, make notes of things and help you remember those things. So that when you have to do sign out, you're like, okay, well, today we gave the patient amlodipine and we did this and this happened. And you just have to, have a process. And I think once you kind of develop that, then you'll, you can be a little bit more efficient and, it'll work well for you. But that's what works for me personally.
Yeah, just kind of going off that. So for like the ER, it's a little different. I remember the first time I kind of called a consult and I did not know what I was talking about before I got the consultant on the phone. So that's a huge thing to kind of know, and to always, you know, if you're not sure exactly why you're calling them because it's still early and it's a complicated patient, like run it by your attending, run it by a senior resident, because you will get yelled at, although it's not appropriate ever to be yelled at, but it's going to happen no matter what. Other residents are going to yell at you. I've had surgery residents yell at me, you know, but you learn kind of, you know what you're going to say when you go into a phone call, and, you know, don't ever go into anything unprepared. And that's kind of just a general medicine rule, but especially like phone calls, if you're waking someone up in the middle of the night, as we frequently do, you know, give them a one-liner, give them the important stuff. And if you're not sure you know what's important, talk to your attending, because, you know, they're definitely going to be willing to help you. And it's all for patient care anyways. And that will take you far, trust me. And it's also one more thing, just doing procedures too. You're always going to make mistakes doing procedures. No one expects you to know how to do anything perfectly. So it's the same thing as, you know, picking up a complicated patient. You know, you're going to try your best, but, you know, review afterwards with your senior, like, hey, you know, I couldn't quite get the, you know, central line in the way I wanted. I kind of couldn't get the ultrasound where I wanted, and have them like review with you after. And you're going to build confidence that way. But just know in the beginning, it's normal to not get things right at the beginning. It's probably going to take you months to get comfortable, even putting a central line in or doing an A line, but, you know, it's all part of the process. So trust the process, and just stay interested in what you want to do.
Yeah, ultimately, that's the whole point of residency. It's a time where you can make those mistakes and learn from them. You have like the attending as your like fail safe. So don't, like, I'm not saying be a cowboy and like make all these mistakes and go rogue, but like it is the time to try things and make those mistakes and learn from them. Because I'm sure all of us are in agreement. We've made a million mistakes throughout our residency so far.
And to piggyback off the procedures, what Annabeth was talking about, yeah, that's for sure. I mean, listen, we're all learning a new skill while you're there. You're going to make mistakes. You know, as long as you kind of learn from, you know, every single mistake you've made, you'll just eventually get it down. It's just about getting reps in there. Nobody expects you to really know how to do it off the bat, but, you know, you should have some sort of idea of at least the steps involved. So try to study before a little bit, try to study after, and you'll build confidence that way.
Really quick, to piggyback off of those mistakes and some of the hardships that you guys have gone through, somebody wanted to know if you had any personal tips for keeping up your confidence. She seemed to struggle in med school, knowing that intern year has a strong learning curve. She wonders what you guys do when you get criticism, and how do you keep up your spirits?
Try to jump back into whatever was discouraging you. You know, give it a little break if you need, you know, a week or a couple of days. But it, like, for me, you know, central lines, I would be the shakiest person ever because I was like psyching myself out. And the sooner you get back in and you can try again, or you get another chance at it and you can show that you're actually okay and you can do it, is the best really way to overcome it. Don't shy away from it. You know, if there's another opportunity to do something or to pick up a, you know, a sick patient and try again with that, do it.
I would also lean on your friends and your family. I mean, you guys have a strong support system. You know, if you're feeling bad, reach out to your significant other, reach out to your family, reach out to your friends, anyone that can kind of get you back into that swing of, you know, feeling better. You know, it's tough. And I think the pandemic taught us all like how to lean on people and how to, you know, go back to recalibrating yourself in a way. And you have to lean on your support system 100%. So lean on them frequently, lean on them multiple times a day if needed.
Yeah, on top of the support system, having some sort of hobby or outside outlet as well for you know, your frustrations or anything like that is great. Be it going to the gym or anything you really enjoy doing, going to the beach, whatever it is. always really helps. And then understanding that, again, the whole process is about learning. So, you're not going to be perfect from the start. Feedback is always really helpful. If you look at it from a positive point of view and one that you're trying to improve. If you're not really getting feedback, it's tough to improve because you don't really know what you're deficient in. So it's you got to look at it with a rose-colored glasses a little bit.
Is there any advice going back to USMLE Step 3, or really, I think anything that you're preparing for exam-wise? Do you have any advice that you would want to share about what the most effective use of your time is for studying? So, for instance, we kind of brought up the question banks, some books you guys were using, different resources, even down to flashcards. What was a strategy you guys set in place? Was there a certain number that you were taking in a day, certain things you were reading? And were you making adjustments for more intense rotations? What did that look like for you guys?
At least like what we've talked about before, at least for general surgery, I definitely try to take it in one of my easier rotations. That'll definitely help. I think, I don't know what the other residents' experience was, but I think a month of studying is more than enough and enough cushion for you to do well on USMLE Step 3. I think a couple hundred questions is more than enough, and that's all I use, honestly, to pass.
Yeah, I mean, the same. I think it's important to start early studying, just a little by little. Whenever you have time, really, whatever you can maintain. Um, sometimes it just doesn't work out that way, and you have to go ahead and really take advantage of the months that you're more free, or the times you're a little more free to get some real good study sessions in there. But studying early is the best.
I agree. And kind of like what we were saying is Step 3, I don't think you have to study how you studied for Step 1 and Step 2 for months. Honestly, for Step 3, I studied maybe like 5-6 weeks maybe total, but I think it wasn't even like hardcore studying. I think you did maybe I was, as long as you're doing questions, I think even if you do like 20-25 questions a day, because like realistically you're not going to have time, you're going to be tired, you're going to be working 12, 13, 14-hour days, and to come home, eat, you just want to go to sleep. So even if you just do like 20 questions a day, I think that's sufficient. You're still learning. Even if you don't think you are, you're still learning on a job, and you're reinforcing it with questions.
Yeah, I'll echo what they said. Just questions and learning from the wrong answers. Why are they wrong? I think that's the biggest thing. I'm personally someone who can't really, I don't get as much value from just purely reading, but kind of like doing the questions and learning how the concepts are going to be tested. I mean, that's the biggest thing. So.
Awesome. Thank you, guys. So last one, I think we're running up on the hour. So somebody wanted to know, again, going back to taking your notes, do you carry something like the pocket notebook?
I do. I think a lot of residents use the sign out sheet. You're going to have a sheet that's given to you with all the patient names, at least for IM. You'll have a list of, all the patients' names, and then I usually just write on that. But when I started, I had a separate sheet. I had two sheets. I had one for the patients I'm following, and then one for the ones that were being admitted. That's basically what I kept. If you want to take nuggets home with you, like some take home points, stuff like that, I thought it was actually more useful to make a note on your iPhone, because you're going to lose that piece of paper. You're going to lose that notebook. It's hard to keep that around with you. I used to, hyponatremia is very difficult to like diagnose an etiology, and how do you get to that point? The algorithm, it took forever for me to remember it. And honestly, I just had it on my phone. If urine sodium is this, if your osmolality is that. I mean, it's something that I refer to a lot, and I liked the convenience of having it on my phone. So I would say keep notes on your phone. Try to stay efficient in that sense, and keep it organized. And all your patient data will probably just be on the sheet that you're given.